Welcome back. Of course, we continue with the latest in as far as informing conversations this week. And as we start the week, we want to take a look at some of the matters due to the coronavirus pandemic. And joining us this morning is Senator Sylvia Kasanga, who is the chairperson of the Senate Ad Hoc Committee. Good morning, Senator. And of course, we know that your committee has been working so hard. First of all, congratulations for now ascending to that position as the chairperson. What are the latest in terms of the focus and how it's been moving based on the fact that now we're at more than 26,000 infections in the country?
Good morning, Sam, and thank you once again, Citizen, for having me on this platform to speak on this issue. Sam, yes, we are getting to a very sensitive part of this battle and war against COVID. And I cannot overemphasize to Kenyans that we really must heed the words of our president that now it's time for personal responsibility. It's actually now moving to the time of personal responsibility. Just this morning, I'm just receiving news that even a country like Britain is now thinking of a second lockdown because the issues of testing and tracing are still a challenge for them. So you can imagine for us the challenges now that we are running out of testing kits and we have such challenges. So you can imagine for Kenyans now, it's better we be alive to the fact that a lot of personal responsibility is required. But to answer your question, one of the first things we have done as a committee since we reconstituted and I was elected chair is to seek an audit from the Auditor General on how the counties are using the COVID funds. As you know, now the focus has shifted to the counties. So we must know the monies that were sent to the counties, how are they being utilized? What plans did the counties have? Has that money arrived? And which bank accounts did that money arrive for each county? Have they rolled out the use of that money based on the plans and the budgets that they had put out? We are even asking the Auditor General to a point where we want his determination on the reliability of any reports that come out of the execution of the work of COVID from the counties. We are asking the Auditor General to detect irregularities that are involved in using of public funds that are meant for COVID. We've asked for such an in-depth report because from a committee level, it's not possible for us to investigate each of the counties with our short mandate, but using the Office of the Auditor General, which has the structures to do so, as well as the control of budget, we shall be able to get down to the detail. Now it's about the detail of it. And we are really looking forward to his report on the 4th of September, which we shall heavily rely on going forward in tasking the counties on the issues of the use of COVID funds. As you know, everything revolves around money.
Right.
Yes, Sam.
Senator, let me cut you short because I know, yes, there has been that request on how the finances have been spent on responding to the pandemic, but there has been several issues, including the Kenya Medical Supplies Agency, that is KEMSA, people saying that there could have been overpricing on some of the equipment that was being bought by KEMSA. I don't know whether all this matters. How much of information have you received, and would you know whether there's been any misuse of resources meant for the response to the COVID-19?
Well, we've been involved in investigating and having conversations with KEMSA at the beginning of our mandate as a committee. And yes, we did find an issue with the pricing of their products to the counties, to the point where the Council of Governors was actually complaining that procuring from KEMSA was a lot more expensive than if they procured directly. And we did even ask for price lists comparisons to see what price lists look like, KEMSA ones and what other suppliers have. And we did find that there was definitely a disparity. The issue of KEMSA has definitely been picked up now even by the Committee of Health in Senate, and we are jointly going to look into this issue with a little bit more depth in it to find out really what happened. We know the funds they were using, they had given us their budgets, so now it's a question of checking whether those budgets were used as they had promised us they would be used. But the issue of price list, definitely we did find a disparity there, and now you know the Council of Governors was encouraged to do their own procurement because of now these challenges that were slowing down PPEs and all that stuff going down to the counties. So you find now that Council of Governors is now being forced to procure for themselves, unlike what the structure was before because of the challenges of KEMSA. Yes. Yes, Sam.
Right. And of course, when you look at the trends, Senator, it's emerging that there are certain counties that are leading in the numbers. You're talking about Nairobi with its 15,000 plus. You're talking about Mombasa with more than 2,000. Kiambu now nearing the 2,000 mark. And also regionally, it would appear that the areas around and near Nairobi are leading in these numbers. But there's the question that not enough testing is happening, especially in the countryside. is there anything that you're doing to ensure that the testing capacity has been boosted to these regions, because the Senate really represents the interest of devolution?
Yes, we are trying very hard, Sam. Let me say, you've already had the Ministry of Health, telling Kenyans that we have a challenge procuring testing kits. Don't forget that these testing kits, we rely on them coming from abroad, and each country has to first take care of their own interests. So that is a fact we have to grapple with. Unless we come up with our own testing kits, which I know maybe they are trying to do so. I'm not sure if there's been a conversation about having our own form of testing, but the most reliable testing kits that we can rely on and that the world has said these are the ones to be used, the World Health Organization, they're few and far in between. So we have a problem with the testing kits, which means we are not testing as widely as we should be. And that is something we have to accept is a reality on the ground. And that is why the Ministry of Health is now pushing towards and has been pushing towards preventative measures, as opposed to the flip side of it, which is now you have to test, then you know who is sick. We are being asked, and they have rolled out enough protocols telling people, look out for these symptoms, and if you have them, don't rush to hospital. This is what you need to do. The home-based care protocols have been rolled out. And it's important we just be sincere and honest about these things. Where we don't have capacity, we say we don't have capacity, and therefore Kenyans, this is a strategy we are going to use. And I can't fault the Ministry of Health for the communication that they have given out on home-based care and preventative measures. And of course, the surge was expected. The surge in the numbers was expected the minute the roadblocks were opened. It was expected. And Kenyans were told, please avoid unnecessary travel. But you know us, we had not seen home. People had been locked out of their places of work and things like that. So immediately people started moving around. And without a doubt, then the numbers are expected to surge. But we cannot keep the country locked down. Already our economy is on its knees.
Right.
The president has said, let's get back to work. So the numbers are expected to surge. But Kenyans, we have to take personal responsibility for this issue. The world is grappling with it. Britain, UK, US, everyone is grappling with the situation, Sam. So we need to really, really take that personal responsibility based on what the Ministry of Health has advised. But as a county, as a committee...
Senator, I need us to wind up. And the question, of course, this morning and last evening, we saw that story of a family in Kisii that have had to go through the harrowing experience of burying their loved one, that is their mother. And when you look at this, because there's still this stigmatization, the bureaucratic stigmatization that you see of how government is disposing, or government officials are disposing the remains of certain individuals. What are you doing as a committee? Yes, to sensitize the public that they need to stay away from a deceased person who has died of COVID-19, but also to offer them the dignity that they require at such a time.
We have engaged with the Ministry of Health on this issue severally, and the ministry has assured us the protocols they have given are such that the dignity of somebody is definitely there. It's part of the protocol. But once in a while, you see a few pockets of something different from what the protocol provides for, and the ministry has been clear to tell us that that is not the protocol. Where you see these things happening, those are individual, probably officers who are doing this, and they need to be reprimanded. And this conversation, we have to bring it back again when we engage with the ministry in the second round of engagements, which we are going to do going forward, because we are going to see a surge in the number of deaths. And we must provide the dignity, because these are things that are causing Kenyans a lot of trauma. Kenyans are traumatized, and mental health issues. Some, I speak about these things all the time. So the least that the ministry can do is ensure that their officers on the ground are giving the send-offs of these families the dignity they deserve. So this is an issue we are going to continue pushing with the ministry. But as you can imagine, the pressure is there for the ministry. The pressure is there, and the pressure is going to increase. We've seen it in other countries. I am sure it's going to happen to us. South Africa is already doing poorly on numbers. They're already over the 6,000 mark of deaths, and their population is not that far bigger than ours. So we are going to, and we touch wood that we don't get to there, but it's a reality now we need to wake up to.
Senator Sylvia Kasanga, thank you so much for speaking to us this morning. She's the chairperson of the Senate Ad Hoc Committee on COVID-19, of course, speaking about the latest and as far as the trends that we're observing. When it comes from the next conversation we'll be having is with some 4 politicians, members of parliament, including a senator. We'll be speaking to Gladys Boss, who is the woman representative for Uasin Gishu, Gladys Wanga, the woman representative for Homa Bay. We'll also be speaking to Senator Ledama Olekina of Narok, as well as Gunjiru Wambugu, member of parliament for Nyeri Town. But as you do so, declaration